Hey guys, Dr. Ray Marquez here, local chiropractic back pain relief center. We're here this afternoon with Alexa, and she's been complaining of a little bit of neck and upper back problems and a little bit of shoulder stuff going on. She's been working out a little more, and this area has gotten a little tight. And it's a real common area that we're seeing more and more lately, especially with technology and people on their phones a bunch and computers and things like that. And then you add a little working out on there and it can get pretty bad. So let's go face down for me. Let's go on your stomach. And the first thing we're going to do is a little bit of trigger point work or some muscle work in order to loosen up her neck a little more. So what I'm going to do, I'm going to put some pressure on your muscles, Alexa. It's a little tender. I want you to lift your head up and look this way for me 5 times. So just look this way. There you go. 1, then back down. 2, little tender probably. 3, 4, 5. Okay, now we're going to do the other side. Okay? 1, 2, 3, 4, 5. Okay, sometimes when we put pressure on these muscle knots and then we ask the patient to go through ranges of motion, it loosens those muscles and relieves some pressure. The next thing I'm going to do, I'm going to use this is a adjusting instrument, and what we do is we kind of just vibrate the joints throughout the spine to break up any adhesions or scar tissue that may be there. Now, I've adjusted Alexa before, and I know she has a little bit of a back issue also, so we're going to adjust everything today. But a lot of our patients come in, if you just come in and you just have neck pain, then we're just going to treat your neck pain. Kind of loosen up the muscles a little more, bring some blood to the surface. I want you to lay on your side, face me. Or that side. I'm going to kind of put you where I need you. It's going to spread you out a little bit. Going to bend your top leg, bottom one straight. Okay, so now we're going to do a lumbar adjustment or manipulation just to relieve some pressure in her lower back. Good. Okay, the other side. Scoot you down just a little bit. There we go. Okay, going to pull your arm out. Straighten your leg out. Okay, another back adjustment, okay? So nice and light. Good. Let's go on your back for me, face up. So next thing we're going to do is a cervical adjustment or manipulation. Just a little bit of pressure, nice and light. Good. Okay, again, nice and light. Good. Okay, come on up for me. Let's sit on the edge and face out. Down to your chest. Okay, we're going to bring you back. Just keep your chin there. A little bit of crack in here. Good. One more time. That's it. Nice and easy. All right, so guys, thanks for watching. Hopefully you feel just a little better. If you have any questions, make sure you comment on this video or go to one of our websites, myrtlebeachwalkinchiro.com, or if you're up in Vineland, backpainrc.com. Have a great day. Talk to you soon.